Hi, everyone, and welcome to our second podcast of the therapy unit. So the first set of slides and the first video really focused on psychotherapy, which is, between a client or a family and a therapist. And today what I want to focus on are biomedical therapies. So these are treatments that involve medicine or a couple of other different ideas, but they're not talk therapies where people are trying to build a relationship and communicate that way. So what biomedical therapies believe about why people have disorders is that there's a chemical imbalance or an abnormality in their brain that causes the disorder. This would be like the idea that serotonin, lack of it causes depression, or too much dopamine causes schizophrenia. So the goal is to correct or improve the imbalance or abnormality. And this is a growing method of treatment as we learn more and more about medicine and can come up with more and more medications to hopefully help clients. So the first type of biomedical therapy is something called electroconvulsive therapy, and it's a therapy that's used for severely depressed patients. It's usually like the last resort where they get a mild electric current sent through the brain when they're anesthetized. And this is, for some reason, they don't know why it works, but it resets the brain, and it actually does help as a last resort when medicines and all other things are not working. But there are some side effects like memory loss, confusion, and a couple of other things. But it is a treatment, and it can be helpful in certain instances. Psychosurgery is a surgery that removes or destroys certain parts of the brain tissue. This really isn't used today, but there was a treatment that used to be used a long time ago, which is called a lobotomy. And basically what a lobotomy is they take an ice pick, a legit ice pick, and like tap, tap, tap up your nose into the brain, and it like messes and kind of jars with the frontal lobe, and then people were like super docile and no longer like had these disorders or like aggressive urges. And it's like, yeah, duh, because you basically damaged their brain. So I'll show you a video clip of this in class, but for a while it was really popular. This is what ECT looks like, just so you know, electroconvulsive therapy. All right, you do not need to write this chart down. I will give you a copy of this chart in class, but there are a couple of things that I want you to know. So what I want you to really know is the different categories of drugs. So there's antipsychotic, antidepressant, mood stabilizers, and tranquilizers, or benzodiazepines, and what they're used to treat. So antipsychotics are used to treat psychotic symptoms like hallucinations and delusions, right? So you have schizophrenic and psychotic symptoms. Antidepressants are used to treat both mood and anxiety disorders. So a lot of times antidepressants are used to treat anxiety. Mood stabilizers are used for bipolar disorder, and benzos are used for anxiety disorders. The problem is that they have very high dependence. So we don't often want to use them, or we use them in conjunction with low side effects and those kinds of things, or short term. So something like Xanax that maybe heard of before is a benzo, but it also works as an antidepressant. A lot of antidepressants and anti-anxiety kind of work together because it's a lot of the same chemicals, serotonin and norepinephrine. So a very important thing to know is that antipsychotics, specifically Haldol and Thorazine, which are older medicines, have a very serious side effect called tardive dyskinesia. And they put this one time on the AP test kind of out of nowhere, and no one really expected it. So now everyone always talks about that this is a serious side effect of tardive dyskinesia, and it's you can't go back. So most side effects, when you have the drug, or when you take the drug, you have the side effect. But tardive dyskinesia is one of those side effects where even when you stop taking the drug, it doesn't go away. Clozaril, risperidol, and Abilify. Abilify and risperidol are the first one that reduce both positive and the negative symptoms of schizophrenia, which is very different. For antidepressants, you need to know that Prozac is an SSRI, selective serotonin reuptake inhibitor. And then you should know that lithium is a common mood stabilizer. Everything else I can give you, you don't need to write this chart down. And this is just an example of how serotonin and how Prozac works. And like I said, it's a selective serotonin reuptake inhibitor, SSRI. So this back to bio, right? A nice little review. You have your action potential, right? And then you have the vesicles, and they have the neurotransmitters. And this is the presynaptic neuron. And then they go here and they go bloop, 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 right? Into the synapse. And then they attach to the receptors of the postsynaptic neuron and send a new action potential. So what happens, and then they get reuptake, right? Well, this reuptake is like a little bit too intense sometimes, or there's just not enough serotonin reception. So what Prozac does is it inhibits or blocks the reuptake, selective serotonin reuptake inhibitor. So it goes in there and it puts these little blocks that stop the serotonin from being reuptaked, and then they just connect again and send another message, thereby lifting your mood. Obviously, since antipsychotic drugs and more drugs have been released, there's been a rapid decline in mental hospitals because people now are more and more functional outside of hospitals, which is a great idea. But of course, along with that comes the controversy of, are we over-medicating people? Are we giving too many meds? Are we giving meds when they're not necessary? And so a lot of people struggle with that conflict. Okay, and whether or not, what should be medical and what should be therapy. The total number of antidepressants in 1999, there's a huge increase, right, in the millions of antidepressant prescriptions. So that really goes along with the theory that we're over-medicating, but medicine can be very helpful when used properly. So that's all for now, AP Psychos, and remember, psychology is flippin' awesome.